in a myeloma, we are among a few centers conducting a trial looking at the drug called pomalidomide, but in a very focused subset of patients. Now, pomalidomide was approved about 2 years ago for patients who have recurrent multiple myeloma. But there's some questions still regarding the utilization of the drug in people whose kidneys aren't very healthy, who have kidney failure or renal failure. And so we're one of a few sites looking at what's the right dosing, how is the drug, how is it tolerated by patients who don't have very good kidney function. And so there's a paper being presented, a poster being presented Monday evening at the meeting, looking at our initial experience with patients who have either very poor kidney function or kidney function that's really at the dialysis level. And so this is very important information, I think, for the myeloma community, both patients and treating physicians to have. And the trial is still ongoing. We're still looking for patients to participate in the trial. But it's just one other thing that we've had the good luck to be part of at CVCI. Whenever you go to the meeting, you wonder, is there a dominant theme at the meeting? Last year, it seemed like it was chronic lymphocytic leukemia, or CLL, was carrying the day every time we turned around. At this meeting in myeloma, I would characterize it as incremental progress. So nothing earth-shattering, but clearly some very important information. And in particular, in the field of myeloma, we have now monoclonal antibodies. And people are pretty familiar with monoclonal antibodies to treat a variety of different cancers. But in myeloma, we haven't had ours, and now I think we've got some. So that we have at least 3 that are out there, one fairly advanced called elotuzumab, and 2 others that are less advanced but clearly moving up the treatment. And there's some sessions at the meeting here outlining both the high effectiveness of these new medications and also their good tolerability. So the medicines look like they're tolerated very well by patients and effective. I think they'll be game changers in myeloma. In myeloma past the monoclonal antibodies, I think what we're learning is that there are a number of just new drug and new drug combinations that we're looking at, refining or adding in an incremental way to our knowledge base for myeloma.